21. What is the appropriate interval for an interruption in chest compressions? A. 10 seconds or less. B. 10 to 15 seconds. C. 15 to 20 seconds. D. Interruptions are never acceptable. Correct answer option A. 22. Which of the following is a sign of effective CPR? A PETCO 2 greater than 10 mm Hg. B. Measured urine output of 1 milliliters per kilogram per hour. C. Patient temperature greater than 32 degrees Celsius, 89.6 degrees Fahrenheit. D. Diastolic intra-arterial pressure less than 20 millimeters Hg. Correct answer option A. 23. What is the primary purpose of a medical emergency team, MET, or rapid response team, RRT? A. Identifying and treating early clinical deterioration. B. Rapidly intervening with patients admitted through emergency department triage. C. Responding to patients during a disaster or multiple patient situation. D. Responding to patients after activation of the emergency response system. Correct answer option A. 24. Which action improves the quality of chest compressions delivered during a resuscitation attempt? A. Observe ECG rhythm to determine depth of compressions. B. Do not allow the chest to fully recoil with each compression. C. Compress the upper half of the sternum at a rate of 150 compressions per minute. D. Switch providers about every 2 minutes or every 5 compression cycles. Correct answer, option D. 25. What is the appropriate ventilation strategy for an adult in respiratory arrest with a pulse rate of 80 minutes? A. 1 breath every 3 to 4 seconds. B. 1 breath every 5 to 6 seconds. C. 2 breaths every 5 to 6 seconds. D. 2 breaths every 6 to 8 seconds. Correct answer, option B. 26. A patient presents to the emergency department with new onset of dizziness and fatigue. On examination, the patient's heart rate is 35 minutes. The blood pressure is 70-50 millimeters Hg. The respiratory rate is 22 breaths per minute, and the oxygen saturation is 95%. What is the appropriate first medication? A. Atropine, 0.5 milligrams. B. Oxygen, 12 to 15 liters per minute. C. Epinephrine, 0.5 milligrams. D. Aspirin, 160 milligrams chewed. Correct answer, option A. 27. A patient presents to the emergency department with dizziness and shortness of breath with a sinus bradycardia of 40 minutes. The initial atropine dose was ineffective, and your monitor/defibrillator is not equipped with a transcutaneous pacemaker. What is the appropriate dose of dopamine for this patient? A. 2 to 10 milligrams per minute. B. 2 to 10 micrograms per kilogram per minute. C. 10 to 15 milligrams per minute. D. 10 to 15 micrograms per kilogram per minute. Correct answer, option B. 28. A patient has sudden onset of dizziness. The patient's heart rate is 180 per minute. Blood pressure is 110 per 70 millimeters Hg. Respiratory rate is 18 breaths per minute, and pulse oximetry reading is 98% on room air. The lead 2 ECG is shown below. What is the next appropriate intervention? A. Vagal maneuvers. B. Metoprolol 5 mg IV. C. Adenosine 6 mg IV. D. Normal saline 1 liter bolus. Correct answer option A. 29. A monitored patient in the ICU developed a sudden onset of narrow complex tachycardia at a rate of 220 per minute. The patient's blood pressure is 128/58 mm Hg. The PET CO2 is 38 mm Hg, and the pulse oximetry reading is 98%. There is vascular access at the left internal jugular vein, and the patient has not been given any vasoactive drugs. A 12-lead ECG confirms a supraventricular tachycardia with no evidence of ischemia or infarction. The heart rate has not responded to vagal maneuvers. What is the next recommended intervention? A. Adenosine 6 mg IV push. B. Amiodarone 300 mg IV push. C. Synchronized cardioversion at 50 J. D. Synchronized cardioversion at 200 J. Correct answer option A. Artie, you are receiving a radio report from an EMS team en route with a patient who may be having an acute stroke. The hospital CT scanner is not working at this time. What should you do in this situation? A. Contact the patient's family to see what they would prefer. B. Have the EMS crew choose an appropriate patient disposition. C. Accept the report and provide care within your present capability. D. Divert the patient to a hospital 15 minutes away with CT capabilities. Correct answer, option D.